Alrighty, so this is a summary of my clinical experience at Sharp Memorial Hospital. I had a two-part rotation. The first 12 weeks, I was at the outpatient neuro facility, and the last 4 weeks, I was in acute. So for this reflection, I'm going to focus on the outpatient neuro section because that setting was a bit more complex, and I got a bit more experience in that section. So starting off, what did you find helpful in preparing for your rotation? So for me, I think it'd be very helpful to review and look up all the neurodiagnoses that we cover in class, because in this setting, you're going to be seeing a big range of neurodiagnoses. So some of the common ones you're going to experience in this clinic are CVAs, Parkinson's, Guillain-Barré, cerebral palsy, amputees, spinal cord injuries, traumatic brain injuries, MS, and a few more ones that are a little bit more rare, but as you stay in the setting, you'll get more familiar with some other ones. So, but those are going to be the ones you're going to see the most, I would say, at least in my experience. And so what would you recommend to a classmate for completing this one? I would say definitely practice being creative with interventions, and practice like different ways you can challenge balance for patients, because in this setting you're seeing patients for a whole hour long, and so this is going to be like not with the aide or anything, but just you and the patient for a whole hour. So you really got to plan and be creative in planning stuff, because you want to like give the patients new challenges to work on and give them new interventions to try. And so I would say just practicing this in different ways, like some examples are challenging balance both static and dynamically, changing like the surfaces, adding some parts of like forward versus sidestepping versus backward stepping, adding obstacles, stepping over things, kind of mimic like what the patient might fall or like have a struggle with in their daily life. So what I would do is I would always ask the patients like, hey, like what's challenging you this week or this month or today, and then whatever, like they might say like, oh, it's kind of hard for me to pick up objects, then we're going to work on that for a bit and try to like copy like what's challenging for them in a safe environment, so that when they go home they're less likely to have falls, because that's going to be a big focus of this rotation, is decreasing the fall risk and increasing the balance of these patients. But that's for the higher level ones. You're also going to be like working with patients with spinal cord injuries that are limited to bed mobilities activities. So that's going to be another thing to work on, is kind of building up like a bigger tool bag of things you can do like on a mat or in supine or prone or side lying, because a lot of the patients you have won't be able to do anything but sitting balance or maybe stuff in supine. So just knowing that that's also going to be an hour treatment. So, just knowing how to apply things to different positions and exercises is going to be very good. Specific challenges, I think the biggest challenge is just trying to fill up that whole hour. I definitely had to come a little bit early the first few weeks to clinic to chart review and plan stuff, because I always wanted to be prepared. But I will say that some things do take longer than you think they will, because in this setting, quality is more important than the quantity you're doing. So you really want to take your time to make the things look right, and that the patient's working the right muscles and challenging themselves the correct way. So I would say that's the biggest challenge, is just being able to be creative and plan an hour treatment with these patients. Expectations. So you'll start off with kind of just watching your CI a bit and kind of grow your comfortability throughout the setting, kind of like most settings. But you definitely should talk to your CI about like what you feel comfortable with. For me, like I wanted to jump in like the first week, so I asked if I can just start like treating a little bit, and she kind of let me ease my way in. And by week 2, I was treating patients with her watching me. So it's all about like your confidence and skill level. But I would say they definitely work you in at your level and what you're comfortable with. So just know that you'll have time to like prepare and watch and kind of take notes and ask questions. And did you like your setting? And yes, I love my setting. This was probably my favorite setting I worked in. I like worked in the acute as well as outpatient ortho, and I think my favorite was definitely the outpatient neuro, just because of the complexity of the patients and the variation you see as far as patient level. Like, one moment you might be treating like a TBI patient who is in their 20s and can run and jump and do super high level stuff, but then your next patient might be someone who has like a cervical spinal cord injury that can only do bed stuff. So it's like just having the mindset that your patients are so different, and was a good challenge, but I really liked it because of just the creativity needed, and also just the one-on-one care with the patient was really cool. And yeah, that's it for my summary.